Hey there! Welcome to today's video on health services management. If you're a healthcare manager or aspiring to be one, you're in the right place. Let's dive in and unlock the secrets of effective health services management. First things first, the primary goal of health services management is ensuring high-quality patient care while managing resources effectively. This means balancing patient needs with financial and operational constraints. Now, who are the key players? Healthcare administrators are at the helm, managing finances, operations, staffing, and compliance with regulations. Meanwhile, medical directors oversee clinical staff and quality of care. Speaking of patient care, a patient-centric approach is crucial. Care should revolve around patient preferences, needs, and values. Involving patients in decision-making leads to better outcomes and satisfaction. To succeed in this field, you'll need essential skills like leadership, communication, a deep understanding of healthcare laws and regulations, and the ability to implement evidence-based practices. Let's talk about some key concepts. First up, the continuum of care, which involves managing patient care across different stages and providers. Then there's integrated care, combining primary, secondary, and tertiary levels for a holistic approach. Workflow optimization is all about streamlining processes for efficiency and quality. And don't forget population health management, which aims to improve health outcomes for specific groups or communities. Technology plays a massive role in modern healthcare. Health information systems, electronic health records, and telehealth improve communication, data access, and remote care delivery. Healthcare informatics and analytics leverage data for better decision-making. On the financial side, budgeting, resource allocation, and understanding reimbursement models like fee-for-service, capitation, and value-based care are crucial. Cost containment strategies also help keep expenses in check. Quality and safety are non-negotiable. Accreditation ensures facilities meet quality standards while risk management identifies and mitigates potential harm. Patient safety programs foster transparency, and quality improvement initiatives use data analysis for continuous enhancement. Legal and ethical considerations are paramount. HIPAA protects patient privacy, and compliance officers ensure adherence to regulations. Ethical decision-making always prioritizes patient welfare. Workforce management is another critical area. Recruiting, training, and retaining qualified professionals is vital, especially in rural areas with limited resources. Addressing job dissatisfaction and promoting workforce diversity are also important. Lastly, health policy and advocacy play significant roles. Health policies address issues like access to care and public health initiatives, while advocacy groups represent patient and provider interests. There you have it, the essentials of health services management. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon for more insights. Thanks for watching, and stay tuned for our next video.